Today, we're going to unpack a really dangerous medical condition that has this scary habit of hiding in plain sight. We're going to use a real clinical case as our guide to uncover a hidden toxin that can turn the body against itself with, honestly, devastating speed.
Okay, so let's just dive right into this medical mystery. It all starts with a young child who, over just 1 month, kept ending up back in the hospital. And the symptoms? They were confusing and they weren't adding up.
So, look at this timeline. It all started on October 16th, a hospital visit for vomiting and confusion. But then, the child seemed to get better and was sent home. Okay, but then, just about a week later on the 24th, they're back again, this time just for vomiting. And again, symptoms clear up, patients discharged. But on November 18th, things took a much scarier turn. The child returned, and yeah, there was vomiting, but also extreme lethargy and a complete loss of appetite. This time, it was pretty clear that something much more serious was at play.
So on that critical third visit, the doctors finally ran a specific test that just pulled the curtain back on this whole mystery. And what they found was the true culprit, a condition that literally turns one of the body's own waste products into a powerful poison, a poison that goes straight for the brain.
And the name for this hidden toxin? Hyperammonemia? It's a super serious condition, and it's caused by having way too much ammonia in your blood. Now, a little ammonia is a normal byproduct of digesting protein, but in high concentrations, it's a potent neurotoxin. And that explains everything: the confusion, the lethargy, all of it.
So what was the test result that changed everything? Get ready for this number: 312 micromoles per liter. That was the child's ammonia level. And a number like that, it's not just a red flag, it's a 5-alarm fire. It is a full-blown medical emergency. And just to really put that into perspective for you, a normal ammonia level is supposed to be less than 50. This patient's level was more than 6 times higher than that safe limit. We're not talking about a slight elevation here. This is a catastrophic, off-the-charts buildup of a toxin in the brain.
You know, when ammonia gets this high, the body starts to shut down in this terrifyingly predictable way. It starts with lethargy and poor feeding, exactly what we saw in this case. But from there, it can quickly spiral into hyperventilation as the brain starts to swell. That's a condition called encephalopathy. Then comes seizures, and if it's still not treated, coma and even death. This is why you have to act, and you have to act fast.
So this, of course, leads to the next huge question, right? Where is all of this toxic ammonia coming from, and why isn't the body just getting rid of it like it's supposed to? To solve the mystery, you have to figure out where the whole system broke down.
Well, when doctors investigate this, they're basically looking down 2 main paths. First, you've got primary causes. These are genetic. Usually, it's a defect in what's called the urea cycle. Think of the urea cycle as the body's natural waste disposal system for turning toxic ammonia into harmless urea. If that system is broken from birth, ammonia is just going to build up. Then you have secondary causes. These are acquired. They happen when a perfectly healthy system gets compromised, most often by something like liver failure.
And here's the really wild part. These secondary causes can be triggered by things you see every day. Liver failure can be caused by viruses, or even an overdose of a super common pain reliever like paracetamol. Certain medications, like the anti-seizure drug valproic acid, can also set it off. It's just a stark reminder that even a healthy system can be pushed into a crisis.
And all of this brings us to the most urgent part of the story, the race against time to get a diagnosis. Because remember, with a toxin actively damaging the brain, every single minute counts.
You'd think measuring ammonia would be simple, right? Just a quick blood draw? Absolutely not. This test is incredibly sensitive, and it is notoriously easy to mess up, which can lead to disastrous delays in getting the right treatment.
I mean, check out the strict rules for this test. The blood has to be from a free-flowing sample, so no tourniquet. It has to be put on ice immediately, then has to be analyzed in under an hour. And get this, if any of the blood cells get damaged in the process, it can create a false high reading, throwing the entire diagnosis off course. One tiny mistake can cost precious, precious time.
So, let's say they do everything right, and they confirm a dangerously high ammonia level. That single number isn't the end of the investigation, it's the beginning. It's like a starting pistol goes off, and now the real hunt begins, to find the source of the toxin.
To figure this out, doctors essentially become detectives, and they have to assemble this entire toolkit of tests. They're checking blood gas, lactic acid, liver function, how the blood clots. They collect urine over a whole 24-hour period looking for clues. It is an all-out effort to gather all the evidence needed to build a complete picture of this metabolic crisis. So when you put all of this together, the vague symptoms, the tricky diagnosis, the frantic race to find the cause, it all points to one single, absolutely critical lesson about this condition.
This quote right here from the medical literature, it just sums up the whole challenge perfectly. A child's outcome, their chance at a normal, healthy life, is directly tied to how quickly doctors even suspect this might be the problem. Any hesitation, any misdiagnosis can have irreversible consequences.
And that leaves us with this central, kind of haunting question, doesn't it? When you're faced with vague symptoms like vomiting or being tired, symptoms that could describe 100 common childhood illnesses, how on earth do you catch a silent killer? The answer is that our most powerful tools are simply awareness and suspicion. It's a powerful reminder that sometimes the most dangerous threats are the ones hiding in plain sight.